Hello everyone. So in this PowerPoint, I'm going to be talking about injuries to the tissue, what to do for most of these injuries, how to deal with it, kind of like a general way of thinking. Just know that some of these will be a little gruesome on purpose. I want to get a lot of you guys out of your comfort zones and to see a lot of what you're going to see normally, and then what the extreme cases where you could see. Okay. So here's a good example right there of a nice, gruesome degloving of that foot. Okay, so a lot of these injuries can be superficial. A lot of them can be very, very deep. It's very, very important to know that you can't see everything that's going on in there, and that other underlying structures could be involved. For example, usually you're going to see an injury to the skin, okay, where it's a laceration, abrasion, puncture, whatever it is, but you don't know how deep it is. Sometimes it's really easy, a little abrasion, they fell, scraped their knee on the whatever concrete, abrasion, okay? A lot of them, if it punctured, if it goes through like all the different layers of skin, it could damage underlying structures that you don't know about. And you can't assume that it's fine either. For example, the fascia. Fascia is a covering over all the muscles, all the organs. It is throughout your body. It's very, very tough, but that can also be damaged, which can affect other structures depending on the injury. Okay, it's more like a spider-like webbing that goes over everything. It's it's a very, very important connective tissue. Okay. There's also cartilage. You'll find that like nose, ears, other parts of the body where it could also be damaged as well. Muscles are always a big one, especially if it's let's say it's like a muscle strain. Okay, obviously, but you don't know the extent of the damage that happens to that muscles. Okay, tendons as well. Let's say it is a puncture. Well, that puncture could affect the muscles or tendons, and you don't know. Same with ligaments. I'm not going to cover any ligamentous testing in this course. That's more advanced things, but there are ways to check the ligament integrity. And they're pretty good for the most part for most of them. But you don't know the extent of that ligament damage, especially right off the bat. Okay, and then veins and arteries. Usually, if there's an arterial kind of injury, let's say they're punctured, and that puncture you see like the squirting. Okay, that is an arterial bleed. That is a life-threatening injury, for example. But let's say it is the artery is damaged underlying. Then you're going to have a lot of bruising and swelling. Same as veins, but arteries are going to be more so. Okay, so there's a lot of different structures that could be damaged that you have to kind of keep in mind. Okay, next is open versus closed wounds. Okay, so a closed wound is one that does not break the skin. That's all it is. Okay, for example, all this nice bruising here. Okay, that's a closed wound. Okay, an open wound, as you see here, with this compound fracture, is the skin is broken and the wound is exposed to the outside environment. That's all that means. Very, very important because now there is the chance of any kind of foreign bacteria or whatever it is getting inside that wound. Okay, that just complicate things tremendously. And it doesn't have to be extreme as this compound fracture here. I believe that's Kevin Ware. But just any kind of damage that broke the skin is considered an open wound. Okay. Next is abrasion. Abrasion is caused by sliding or skidding on pavement, concrete, dirt, sand, etc. Typically, these wounds are not deep. Okay. They need to be cleaned to prevent infection. Okay, that's really, really important. Usually, these are very, very superficial, as you see in the picture here. This is just it only went through maybe the first like few layers of skin. It takes a little bit of time. You want to keep it generally moist for the most part. You want to wash with soap and water. You do not want to use alcohol or peroxide or what's the other ones? Anything else? Okay, just you want to make sure that you just kind of clean it. That's it. You don't need to really disinfect it by any means. Using, I can't remember if I get more in depth on some of this later on in this section, but you should never use peroxide or alcohol to clean or disinfect a wound. Okay, that is very much a myth. That's what our parents and grandparents used to do way back in the day. But all the research shows that is the worst thing to do. You slow down healing. You kill a lot of important tissues that is still alive. You cause scarring. And it is not the best thing to do for that wound. The body does a really good job of protecting itself, and the use of like triple antibiotics is a good, easy way for you to take care of that wound. Okay, but for the most part, you should never use alcohol or peroxide or iodine or anything like that. Just kind of soap and water is probably the most extreme, but most of the research is showing just irrigate with water. Okay, take a hose, put it under a faucet, just kind of get all that off there. Okay, apply that first aid cream, which is going to be that antibiotic cream. Usually you want to use the best is like the triple antibiotic cream. That's just 3 different antibiotic ointments. It covers just a broader spectrum of items. And all the antibiotic does is it prevents the cell wall from forming on that bacteria. Okay, it promotes the optimal healing environment. Now, I don't want to say that it heals faster, but it's the best healing environment. That's very, very important. And you can put that directly on. I wouldn't put it on a wound that is still kind of gushing. I would try and like slow down a little bit before I put that on there. And you want to cover with some kind of gauze pad, whether it's non-adherent or adherent. I used to have some non-adherent here. Yes. When I talk about that, I mean, so this is 2 different types of gauze. Okay. So this is adherent and this is non-adherent gauze. Okay. So if I open this up, let me make my screen a little bigger. Okay, so this is normal gauze you get at the store for both of these. So the adherent ones, if I open it up, it is very, very porous. Okay, as you can see, you can like see through it. It does a really good job of soaking up any kind of fluid, blood, for example. The downside of it is it sticks to a wound. Okay, which is important because this can help because all that lattice-like items, that porous, can help clotting, which is really important for that, let's say, heavy wound. But when you rip this off, you're also ripping off that clot, which may or may not be what you want. But a lot of times this is really cheap. It comes usually in bigger packs. You see here, this is a pack of 200 4x4, so 4 inch by 4 inch. This whole thing is probably, I mean, we get like wholesale, maybe about $5. Okay, and that's a lot of gauze. This is non-sterile gauze. Sterile gauze is individually packed. I don't think I have any on me here. For the most like heavy bleeds, this is what you want to use, and you don't have to be shy about using it. Like I will probably rarely ever use 1 piece of gauze. If it's like a moderate wound, I'll use maybe 3 or 4. Make sure it soaks up everything. If it's a heavy wound, I'm just going to grab handfuls and hold it on there. On the other hand, this is the non-adherent gauze. So you can't see through it. I can't open it up. Okay. Look, a lot of times this is going to be what's going to be on the Band-Aid. This is that white little patch on the Band-Aid that you put on the wound. The non-adherent gauze, it doesn't soak up any kind of blood or fluids like the non-adherent does, or like the adherent does, but it doesn't stick to the wound. So if I have a little cut or even that abrasion, as I had in the picture before, okay, so let's say in the picture here, I would probably want to use this. It's not going to stick to it. I can put the triple antibiotic directly on the non-adherent pad and put it directly over the cut. That way, it keeps that cut moist, which is what you want. They used to be keep it dry. They're kind of going away from that. Moist is a better environment, less chance of infection for that. A little bit faster healing rates. And then I'd cover this up with whatever it is. Let's say if they're doing an activity where they'll be sweating, a Band-Aid isn't the best idea. It's not wrong, don't be wrong, but the Band-Aids, that stickiness is not going to stick to a moist, sweaty skin. What is good if you have is this is a non-adhesive, what's it called? It's non-adhesive, but it's a cohesive dressing. Okay, so this brand is Powerflex. There's not other ones that are a little bit cheaper. Okay, so this is actually developed for veterinary items because it's not sticky. Okay, I'll stick my hand, but it sticks to itself. It does a really good job of that. Okay, so if they're doing like activity, whatever it is, I would put whatever gauze, treat the injury however I need to be, and then I would wrap it up with this cohesive bandage. Okay, and then this just gets thrown away. It does rip, so I use however much I need to, and it just sticks to itself. Okay, it's decently expensive if you have to have it, but it works pretty well, and it bends. It does soak up some fluids a little bit. I wouldn't use it like in replace of gauze, but if the person that you're working with, let's say they're an athlete and they're a swimmer, this will be a little heavy just because it soaks up fluids and sweat a little bit. But it does do a really good job of sticking that, let's say, non-adherent gauze to this knee abrasion. Okay, there's my little side note on wound care. Okay, so when I talk about wash that abrasion in soap and water, okay, wash soap and water, make sure you get all the kind of dirt out of there. You don't want anything that kind of stick in there. A heavy hose, like a really strong current, is not a bad idea. Get everything out of there, and then triple antibiotic cream. Keep that abrasion kind of moist. Cover it. Treat that bandage every day. Or let's say if they're doing like heavy activity, like workouts or games or whatever it is, you want to change it after that event. Okay. Follow-ups. Okay, you can change every day. Watch for signs of infection. Usually, infection is going to be that really bad redness around the outside. I have never actually seen red streaks for like blood poisoning. I've just read about it. I've actually never seen that. But you also will witness a smell, a really bad discoloration inside the wound. It can turn white. That kind of like dead tissue that your body is just kind of getting rid of. And that's kind of normal. Nothing wrong with that. But you want to keep in mind the infection around. And this is for every wound, not just for the abrasion. But if you have a deeper wound like this, you may need to pack it. I would consult your physician for something like the bigger wounds. But let's say you have like this wound, for example. Someone just took a chunk out of there. Maybe you got bit by a dog. I'm just going to pack it with gauze to try and slow the bleeding. I'll probably keep that gauze moist. And then I'll wrap it up and then send them to like urgent care or the physician or ER or wherever is the optimal solution for that, for them to take care of that. Just because this would be a bigger wound, especially if it's red on the outside, that shows that side of infection, then I would make sure I bring that to attention to my physician immediately for that. And they'll go beyond the antibiotic ointment and do the prescription pills. All right, lacerations. Okay, so laceration is caused by a tearing motion, usually a result of a kind of a jagged wound. Can be minor or deep. Okay, for example, this is a full thickness injury. Okay, so full thickness is what it means is it goes through all the layers of skin. Okay, because there's like 6 layers of skin, 7 on your palms and the bottom of your feet. But it goes through all those different layers of skin. That's a full thickness injury. That's very, very important because you don't know what underlying structures are involved. Okay, so I'm assuming this is a knee. Okay, it looks like there's a patella right here. Just from the look of it, I mean, it could be an elbow too, but most likely a knee. All right, so we have the patella tendon, which runs right here, which could be affected. We have the patella, which could be affected because there's a little injury here, probably not anything crazy. There's a lot of fascia here, or any other ligaments. There's the meniscus, which is like a shock absorber in the knee, which is deeper. That could be affected. So you don't really know the extent. Okay, obviously blood vessels. There's a lot of small like nerves in your skin, which could be damaged, but you don't know. Okay, so this is where you would kind of recommend to a higher entity to get treated. Okay, because this one's going to need stitches or staples or some kind of wound closure just to take care of it. But for this, I would grab a good amount of gauze, hold it on there, try and slow the bleeding down, wrap it up, keep it stable, and then I would refer them off to like urgent care or ER or somewhere pretty urgently. Okay, so that is what a laceration is. Okay, soap and water. In this case of this, I would just kind of irrigate with like a hose or a under a faucet. Okay, compress it again. Stop bleeding. Refer them. They're probably needing stitches. Anything longer than an inch, inch and a half probably require stitches. A tetanus shot may be needed as well, depending on whatever it is. I'll let the MD or DO dictate that. Follow up. Okay, monitor the wound for redness, heat, swelling, streaks, or any kind of drainage. Okay, that's just follow up for any kind of infection. Okay, really, really important. The heat, redness, and swelling is often like a big sign. Again, red streaks and drainage if they have any extra kind of open wound. Okay, puncture wounds. Okay, really, really important to leave that object in place. Do not take it out. Please do not take it out, no matter where it is. Okay, if it's embedded, let's say it's a nail, if it's a knife wound, do not take it out. Okay, often not. Whatever is going through, taking it out will cause more damage. Okay, no matter. I mean, wait for them to take it out in the ER. Okay. If need be, try and fix it in place with anything, kind of gauze, a strap, something to make sure it doesn't move around so much. Let's say if it's a stab wound, if someone got stabbed and the knife's still in them, that's kind of occluding any, let's say, artery. So if you take it out, they're gonna, that artery that's now occluded or kind of pinched off from that knife is going to open up. Also, a lot of like knives are serrated, so you're going to cause more damage pulling it out, or they're jagged, like on the back end of it, or even like a nail, for example. Okay, a lot of nails have some kind of engravings on the side or rough edges, that way they don't come out very easy. So you're going to cause more damage trying to pull it out. You're going to damage more structures. So whatever it is, do not pull it out. Okay, no matter what, do not pull it out. Leave it in place. You can pat gauze around it. Okay, control any bleeding if there is some. Okay, keep the person calm, but do not pull it out. Okay, stabilize it, tape it in place. You can irrigate it, but you don't know what's going to happen to it. Okay, and you know what underlying structures that it has punctured. Okay, wound splitters. Okay, these are ones you can't take out. Okay, or it's wood, metal, glass splinters also kind of suck because you can't see them. I would irrigate those with water. If it's like a little wood splinter, do not soak that in water because wood expands with fluid. You would want to get a really good pair of tweezers for this. The ones I usually use when I practice are about $20. I mean, some of you guys are thinking that's $20, that's a lot for tweezers, but they're nice tweezers. I mean, I'm going to pull something out, I'm going to pull it out. And I want it out usually in the first or second attempt. They're very, very fine. They go together really well. They're a little high-end, I know, but they're absolutely worth it if you're taking splinters out, usually like weekly. Okay. Training that squeeze or apply pressure to the tissue that can cause that whatever item is to go deeper in. You want to pull let's say the wood splinter out in the same direction it goes in. That's really, really important. Do not try and cut the skin to take it out. That's a bad idea. Okay. Incisions. Okay, incisions are a clean, straight, knife-like cut. Okay, they can be deep. They can damage a lot of muscles, tendons, veins, arteries, nerves, you name it. Because usually the knife, for example, cuts very, very cleanly. Okay, and very, very unrestricted. Like you're just cutting through a steak. Okay, you're just cutting through tissue. That's all it is. Whether it's tissue on a cow or a pig or human. Okay, a lot of times the incision is going to happen with someone trying to cut something. The knife's actually kind of dull, and you use a lot of pressure to cut it, and it slips, and that's when you cut yourself. Okay, so usually the incisions can be very, very. They're usually almost always full thickness, and they go very, very deep. Okay. Treatment. Okay, incision. I'm just gonna irrigate with water. Really. I put soap on here, but really water is a really important thing. It will, once the physician or whoever takes care of it dictates that there's no underlying structures that are really damaged or whatever it is, they use some kind of stitches or staples. Okay, whichever one they dictate. Nothing wrong with staples. They're usually an old school thing. They're coming kind of back. What I'm seeing is they're a little more common for the areas of the body that require more tension to keep together, like on an elbow, on a knee, for example. Even a lot of post like knee replacements, I see them doing staples instead of stitches. They're stronger. They're just as easy to take out as stitches. There's no issue. It keeps that wound together pretty well. Okay. Another thing that you can use is Steri-Strips. This is a more over-the-counter thing. It takes some practice to do them, but they do work pretty well. They're not really invasive. They can be used temporarily till that person gets to wherever to get stitches, or they can be used in place of stitches. I use them pretty commonly to keep kind of wounds together when I send someone over to like urgent care, or ER, or wherever it is, especially if it's not like a really urgent thing. Let's say it's a small 1-inch laceration or incision. After I clean it and the wound's pretty much like stop bleeding, I'll use Steri-Strips. I'll just take, and these little strips, this is like the newer version of the butterfly Band-Aids to keep things together. They're pretty sticky themselves. I often use a extra adhesive, kind of like, I don't want to call it glue, but it's more like a glue-like substance I'll put on both sides of the injury, okay, after I kind of clean it. And I'll disinfect along the outside with alcohol. Not in the cut, just I'm going to clean outside of it. And then I'll put that whatever adhesive, glue, whatever it is. There's a bunch of different ones that you can use. And then I'll close the wound with the Steri-Strips. Okay. And it takes a long time to kind of get used to this because they can be kind of small. I do have pretty large hands. And so depending on the class that you see this video in, we may have an opportunity to practice some of these. I think it's kind of fun, challenging, and irritating at the same time. But that is a simple way that we can do this for, let's say, like athletics or any kind of outpatient facility. Avulsion. All right. Avulsion is a soft tissue injury in which the flap of tissue is torn loose or pulled off completely. So let's say this is like an avulsion injury. So if the skin is still attached, try and flap it back. Okay. This is important because that piece of skin is still alive, and that can help just kind of preserve it and keep it in place. And then when you send the person off to probably ER, they can do a better job about making sure that everything's kind of reattached and everything else. Okay. Flopping back will also keep that skin alive as long as possible. Okay, so they can do a better job on it. But that is a avulsion injury. Usually, I don't see these too often. But it's going to be like motor vehicle accidents or some kind of really crazy thing. Clean the area. Still compression, stop bleeding if possible. Reattach the torn tissue. If you can't put it back on for whatever reason, save tissue in a moist gauze. Wrap it in a plastic bag. Put it on ice. Do make sure the tissue does not immediately touch ice, okay, because that can kill the tissue. Okay, but make sure it is on ice. Okay, and send whether athlete or person to the hospital. Next is callus. Okay, so we're coming back down from the extreme area. Okay, so a callus is a thickening of a piece of skin, usually caused by a friction or pressure. Okay, popular on the hands and especially the feet. Okay, so the feet you'll see them usually the ball of the foot, on the big toe. A lot of time it might be this entire area right here. Okay, so it's not really the worst thing in the world, but you do want to fix the problem. Okay, so what's causing it? Usually it's friction from a number of different areas. Usually it's footwear. Okay, so look at, let's say, cleats. This is the big one, or running shoes. Okay, are they too tight? Are they too loose? Okay, are they worn down? Is it time to get new ones? Let's say calluses are really common in runners. Okay, so look at the running shoes. Okay, general rule of thumb for runner shoes is if there's any kind of wear on the bottom of the shoe, it's time to get new shoes. So a lot of the really intense runners will know that they may have to get shoes every 3-6 months, depending on their mileage. But that's really, really important. The first thing you got to do is you got to change footwear. Okay. Most calluses are non-painful. Some can be just because of the lot of pressure that they build up in. Okay. In this case, you'll have to just file them down, or this is a like a shaver for calluses. And it's pretty nice. It's not really expensive. I've never seen them in a store. We just buy them through online. But it shaves off all these calluses really, really easy. It leaves all the soft tissue intact. It only takes off the hard tissue. There is a razor blade on there. But that can help just kind of relieve any kind of like pressure. Okay. But really got to look at what's the cause of all that friction. A lot of people, when it happens, is their socks could be moist. So maybe if they change socks more often. If it's like one issue is not solving it, have them double sock. An easy way to do that is to wear like a pair of like nylon socks underneath, and then wear whatever your normal sock outside of that. That way the socks rub against each other and not on the skin. That's another way. Next are blisters. Okay, so blisters are very similar to callus in a way is it's usually caused by friction. Okay, it's a bit of a fluid under the skin. Usually it's something similar to this. Okay, sometimes where they can pop, they can look kind of like disgusting like that. It happens. Okay, do not drain them. Okay, if they drain on their own, that's great. One issue about people draining them is they open it up for possible infection. Okay, so try not to drain them on your own. They can, or take it to someone that is qualified to drain them. Again, look for the cause of friction. Okay, try and figure that out. It could be a number of different things. Usually the number one thing is going to be the shoes. It's too tight or too loose. Okay. Trying to think of anything else I didn't ever talk about. Okay. Sometimes we can actually, once, let's say, an athletic trainer or MD or nurse practitioner, whoever it is, if we do drain them, we can fill them with, let's say, like zinc oxide, for example, which is the same item you put on like diaper rash. If you guys have kids and know what I'm talking about. It's just this item that can help dry it out. You can also put like diaper rash cream on something like this, okay? Because it's just that underlying skin is just very premature. It just helps kind of dry it out. Okay, so that could help a little bit for that. All right, next is hematomas. Okay, so hematoma is a blood-filled, usually swollen area, okay, under the skin. It's a closed wound, okay? Damage can include soft tissues, Muscles, blood vessels, skin usually is the biggest thing there. Okay, a blood blister is a type of hematoma. Right? Some people get them on their hands. Okay, don't drain them. Okay, they'll go away on their own. Nothing wrong with it. It looks kind of weird. Other times it could be as bad as like this one on the head. Okay, I'd be more concerned about other areas besides the hematoma. Okay, on this child that fell, child or infant. I would also look at skull, cranial damage, concussion-like symptoms, or anything else. What's also bad about this area up here is that's probably going to drain at some point, and it's going to give this kid a huge black eye. Okay, in this instance. But hematomas, I wouldn't do like a lot of things. I would just kind of give them some ice over them and let them go down their own. Okay, but keep in mind the items underneath that could be affected. All right, so there is rice. I don't know why the R is taken out of here. Okay, but rest, ice compression, elevation. Let me just, there you go. Okay, so RICE is an acronym for rest, ice, compression, elevation. Okay, there's other different forms of RICE, like there's price, which the P is protection. There's also one with an R at the end, which is RICER or pricer, whatever it is, which is referral if need be. So just use your best judgment. Okay, so rest it, make sure it doesn't get worse. Ice it kind of calms that injury down. Okay. That's all it does. It kind of slows down the metabolism a little bit. Okay. Compression, that can just keep that injury from swelling out more. And then the elevation is really good only if that extremity, for example, is really, really swollen. And you're trying to drain all that swelling back towards like the core of the body. Let's say if the ankle was just, let's say you have a huge ankle from an injury. Well, I'm going to do all these four at the same time. Okay, rest it. Obviously, I'm going to take them off of it. Ice compression, so I'm going to put an ice pack on them, wrap it up with a compression bandage. I'm going to elevate it. I'm going to put it up against the wall, up nice and high. And I keep it there for roughly about 20 minutes, no longer than 20 minutes. Okay, you can ice 20 minutes every hour, max. That's it. That's the highest you would do. Usually with the athletes I'll work with, I'll tell them 15 minutes. That goes about 5 minutes of wiggle room. But don't do any longer than 20 minutes, okay, every hour, okay? So they can ice 20 minutes, 24 hours a day if they want to. They got to take a good amount of time off in between, okay? You can repeat as much as you want. All the ice does is it helps just return that, try and slow down the metabolism, okay, of that injury, which is really, really important because that can prevent secondary injury, that can prevent a lot of swelling, that can slow down some blood flow of the injury. I don't want to stop blood flow. I don't want to freeze the injury. Okay, keep that in mind. You do not want to freeze it. You just want to slow it down. Okay. Ice can also help with pain. It can help slow down the impulse on the nerve, which can decrease the pain. Ice does not mean that the injury heals faster. Okay, just know that. The effects of like long-term like icing, for example, on whatever injury does not increase healing times. Okay. One other thing I'll talk about is the chemical pack versus a wet ice pack. They both do a great job. Chemical packs do get colder than regular ice. So you do need a barrier between them. A lot of times you can buy like instant ice packs. You can make your own chemical pack. It's really easy and pretty cheap. But if you put a chemical pack directly on the skin, you can give yourself a freeze burn or a freezer burn. Okay, so you can freeze that top layer of skin to, it's like you've seen the movies where they lick the pole and they have to rip their tongue off the pole and it ends up ripping off a piece of the tongue. That will happen. Okay. Versus if you just take like a bag of peas or a just ice in a bag and put on there, that's usually you put that directly on the skin. I wouldn't put it directly on like an open wound. It's just too cold for that. But I would maybe put a little barrier in between. Like a paper towel, for example, does a good job. If you want to make your own chemical pack, it's really easy. All you need is some rubbing alcohol, like a gallon bag, and water. So it's 1 part rubbing alcohol to 3 parts water. And that's all it is. Put it in the freezer for, depending on your freezer, half a day or whatever it is, and it comes out like a slushy. Don't drink it, but you can hold that directly, put it in a pillowcase as your barrier, and put it directly on whatever area you want to ice. Next is a contusion. Okay, so contusion is a bruise. That's all it is. Okay, you say bruise, I say contusion, same thing. Oftentimes with that kind of contusion, that discoloration of skin, that is called ecchymosis. Okay, here's that nice word here. So if your parents ask what you learned in school today, you can say, I learned what ecchymosis means. Okay, and contusion usually caused from some kind of blow to the body, blunt force trauma, whatever it is. Okay, keep in mind what areas could be affected underneath. Excuse me. Severity depends on the amount of soft tissue crushing and force applied. Often with that kind of discoloration and that bruising, you could have swelling, you could have pain, you can not have anything. Swelling isn't the best indicator of the extent of the injury. Just keep that in mind. Same with discoloration. Discoloration is just kind of an injury to the kind of capillary beds. And that's just what happens. It takes a while to heal. All right, so there's mild, moderate, and severe contusions. Okay, so mild contusion, point tender, local pain, that's had an injury, and they're usually normal range of motion. ROM is just range of motion. A mild contusion, swelling, point tenderness at the site of injury. Sometimes a decreased range of motion, and they could, if it's like a lower body, they could walk with a limp or some kind of abnormal gait. Gait is just a fancy term for how they walk. Okay, severe contusions, tenderness, swelling on and around the site can cause severe decrease in range of motion, usually unable to walk. Immediate treatment, okay, rice. If it's like a big muscle fiber, big muscle group or big muscle in general, I want to ice that area on a stretch, not like a crazy stretch, just as much as they can tolerate. Okay, you don't have to go crazy, like a little mild stretch, like a quad, for example, like a big muscle like that. Just have their knee bent when you ice it. That's it. Okay, that helps just limit the amount of room that blood can accumulate, which I'll talk about a little bit later on what happens when blood kind of sits there for too long. Again, I can ice for 20 minutes. Okay, try and keep the range of motion. Monitor for girth. This is one where you just kind of want to measure around to see if that swelling is getting worse and worse. Okay, which just means that there's more blood sitting in there, especially with all that discoloration of that contusion. All right, you want to continue with any kind of treatments to make sure you get that swelling out of there. I want to do any kind of really crazy exercises yet, unless you really know what you're doing, like really know and like are certified to do this. Given we're still in contusions, mild stretching, okay, mild, just to try and keep that range of motion. Okay, padding can be used to protect the injury, distribute the force away from the injured site. Okay, so let's say we're talking football. A common spot in football to get a lot of contusions is the quad, especially like running backs, and like linemen, for example. So you made like they have thigh pads for a reason. Okay, oftentimes for like running backs, I'll have them double pad their thighs, especially at the college level, sometimes at the high school level. Just try and distribute more of that kind of force away. Next are muscle strains. Okay, so when I say strain, you think of that as a pull. Okay, so a strain and a pull are the same thing. Okay, the exact same thing. The medical word is strain for this. Okay, so a muscle or tendon strain results in overstretching or tearing of that muscle, fascia, or tendon, or combination of those. Okay, I think I talked about this previously in this course, but for the strains, there's 3 grades. Okay, There's, I think I'll go more on this here in the next few slides. Yes. So myel strain, often caused by a muscle spasm. The spasms can cause strains. Yes, they can. Or an overstretching of that tissue. Okay, so usually I have local pain with contraction that decreases with stretching. Some decrease in range of motion, point tender, mild loss of function, possible muscle spasms. Okay, usually not too bad. Moderate strains, okay, more painful when muscle is contracted or stretched. Okay, may hear or span or tearing. I don't know what that is. May hear or feel. I don't know what that is. May hear a pop, feel tearing, whatever it is. They could have delayed discoloration, so that ecchymosis there. Point tender, moderate swelling, moderate to severe loss of function, okay, and possible spasms, okay. Severe strains, okay, is a rupture of that tendon or muscle tissue. It's rare to have a severe strain, okay, because that's usually a complete tearing, okay. Decrease or increase in range of motion. I say increase because there's nothing restricting it anymore because that muscle or tendon is now gone. Severe loss of function, most likely a muscle spasm at some point. Defect in the muscle that is palpable. Okay. Hearing a pop or snap. Okay. A lot of times for the muscle strains, you're going to have grade 1, grade 2, which is grade 1, grade 2. Grade 3 is really rare. I'm trying to think if I've ever personally seen a grade 3 strain, and I don't believe I have. But usually the grade 3 is going to require surgery and immediate ER, pretty much due to pain, for a lot of those factors. Grade 1 is really common. You're going to have micro tears, okay, in that tissue, which is pretty easy to get, honestly. Grade 2 is you're going to have micro tears. You can feel deformity in there. Not all the time, but you can. Because really kind of that decreased performance. And not going to be able to do anything. Even with a grade 1 strain, they're not going to be able to do a lot. Okay, so they're not going to be able to run properly. You're pretty much like pulled from any activity, okay, for a decent amount of time. Okay. Grade 2, obviously they're not doing anything. Grade 3, they're going to be probably sitting in the ER. I have seen a grade 3. Achilles rupture is a grade 3 muscle strain. Just know that. And usually the Achilles rupture is pain initially, and then there's no more pain because the nerves is torn. The nerve is torn in the tendon or muscle. All right. Treatment, okay, I can talk about this. The RICE technique. Rehab is really, really good for muscle strains. So you would see your athletic trainer, physical therapist, whoever, for that rehab. Modalities. That's a fancy way of saying some kind of external kind of treatment like ice. Like a TENS unit, if you are know how to apply one and are qualified to. Therapeutic ultrasound, massage, whatever it is, but you need to know how to do this properly. Like if it's a muscle strain, no massage. Okay, no heat. Just use ice if you're going to do anything, ice and rest. Okay, but the modalities I have it in here because that will dictate a lot depending on the injury. Okay, for example, if you are a physical therapist or athletic trainer, I'm going to use modalities. I'm going to use ice. I'm going to use more of a TENS unit, as you see in the picture here. I'll use, this is like a TENS unit on crack. This is a electrical stem unit. Okay, so I do have the option of doing ultrasound, which I will not do in a muscle strain normally, especially the grade 2 and grade 3. But I'll use the little pads, just similar to a TENS unit, to try and kind of block out all the pain, maybe do some muscle reeducation later on, kind of thing. All right. Last one I'm going to talk about is heterotropic ossification. This is previously known as myositis ossificans. Okay, it's a new name. I don't know the reason why they changed it. Whatever it is. So this is calcium is produced within the muscle after a blow. Okay, that just kind of happens. What happens is all that blood that sits there from those repeated contusions can sit in there, and I'll also show the picture. It looks like this. So that all that blood accumulates there from the repeated blows, and it doesn't go away. They don't like push it away. Let's say they don't like on a quad injury, quad contusion, they don't ice it on a stretch. And it sits there and sits there, or they get repeated quad contusions from football season long every day, and it sits there, and all that calcium from from the blood or produced from the muscle after a blow calcifies. Hence the ossification. Okay, and then now you have bone that is formed within that muscle. Okay. And these are just X-rays. This actually just shows bone. This one is probably a result of a knee replacement. Okay, the person probably didn't take care of their knees properly, didn't do the rehab, whatever it is. And you can see a little bit out here in the outskirts. Okay, but oftentimes they can break it up if it's early, or they have to go in and surgically remove this bone in the muscle because they can't bend that knee anymore. Okay, or wherever it is. It's common on like the thighs. A lot of time they'll have I think it's called blockers exocytosis in like linemen, which is the same thing in like the bicep and tricep. Usually linemen get those. But this is that mass, you really want to prevent it. So that's why you want to, for all these contusions, ice on stretch. Try and get some of that swelling out of there. So that injury that's so that really bad kind of discoloration, ecchymosis from that contusion, you just want to get out of there. Okay, and that is, and then the follow-up treatment for that is just kind of try and prevent it. Okay, and try and keep the range of motion. Disbursement pad, which is like a donut, just another padding that I would put like on a quad, for example. But that's what you want to do. Like refer them to their physician to make sure that you try and get rid of this as soon as possible, as early as possible. And that is injuries of tissue.